POSDB. Those are the functions of management. Let me explain, okay? So P stands for planning, O organizing, S staffing, D directing, and the latest addition is budgeting. If you have that, then you have all the functions of management. In the principles of management, do you want to brainstorm before I get into them? Just brainstorm really quick. 7, 8, 9, 10. So the first one is teamwork. That is the easiest. You should never miss to see that point. Because when you don't have teamwork, then everything else is likely not to work. We have responsibility, accountability. We have centralization. This is, for example, how we have a nursing station in the middle and then the other patient rooms. And information has to come from the charge nurse going downwards to prevent any miscommunication. Understand? And then we have stability of tenure of personnel. We want as much to avoid a lot of turnover of staff. That is having staff leaving and others coming in a facility. Imagine orienting one staff, then after some time the staff is gone because they could not find job security or other demotivating factors. So that's another principle. Then we're talking about division of labor. This is common sense. You cannot do everything as a nurse. That is why we have 2 nurses every time for a procedure. And besides that, there are so many tasks in a department. We are giving drugs, we are doing wound dressing, and these are individual to departments, and we need to divide those tasks all through. And we have the scalar chain, which is also called the chain of command. This is where we have the organogram, and an organogram is that structure that shows us how the power is from up going down. The last 2 are unity of command and unity of direction. These are kind of self-explanatory. So let's talk about the nursing care delivery modalities. The first one that I'm going to talk about is functional nursing. This is where we are delegating according to tasks. Probably there are 5 tasks. So every nurse has a task to do. Okay? Maybe there's wound dressing, there's a nurse for wound dressing, there's a nurse for treatment, there's a nurse for bed bath. That is functional. I see this work mostly in most facilities with a higher, bigger number of patients. Team nursing, all of us are working following a leader. For example, a charge nurse, they give us instructions and what they are doing, and then we follow what they are telling us to do. And then we do have primary care nursing. This is usually one nurse caring for a patient over a period of 24 hours. This model is so applicable in the ICU setup because the nurse is doing everything for this patient, straight from bathing to feeding. Everything this patient needs, the nurse does, all right? And then we do have case management is where nurses are allocated to care for patients depending on the cases that are available. For example, we have acute cases. We can have a nurse taking care of that, another one taking care of chronic cases, another one taking care of injuries, another one taking care of old people problems, that is going to be a thing. And of course, we have differentiated nursing management. This is where nurses are allocated according to their area of expertise. I was thinking in the line of where we have LPNs, we have, and then we have an RN, and then we have a CNA. People are allocated according to the area of expertise. We're going to be asked about quality management. And, this is administration of policies, processes, anything in particular that minimizes harm to this patient and provides positive outcomes for this patient. You understand? For example, handing over of a patient is going to do that. We're going to be optimizing the care of this patient if we hand over a patient properly. If we have a stocked emergency trade of drugs, then we are minimizing harm, because if an emergency arises, then we know that the emergency tray is stocked and we can go and get that drug instead of starting all over again to go and order this drug in the pharmacy. You'll be wasting a lot of time, hence causing a lot of harm to this patient. Okay, anything in that particular line that you see, if we do this, then we are going to be making sure that patient care is optimized, That is quality management, okay? Then you will need to go and look at the hospital policies in the place where you're doing your assessment. There is usually it there, or you just Google it. If it is not available on Google, it is somewhere there where the core values, down there is a hospital policy. And then of course you need to know the emergencies that are in that department. For example, if you're doing the assessment in the medical surgical department, emergencies that you're likely to experience: hypoglycemia, we're experiencing hyperglycemia, we are experiencing asthma attacks. So emergencies will vary depending on the department that you're in. For example, in pediatrics, you're likely to have probably hypothermia, anaphylaxis, burns. In medical surgical, we're having acute appendicitis, we're having intestinal obstructions, diverticulitis, burns as well, any injuries, especially trauma, especially to a pregnant woman, that is going to be an emergency. We're going to do the management in the gynae ward. Of course, the emergencies as well are going to be different. You definitely are going to get asked about CDA, that is Controlled Drug Act, and this is just guideline that states safe usage of psychotropic drugs. Mostly the question that is going to come from here is examples of those and the drugs that are available in your facility. Cut across, and they differ depending on the facility, but morphine is usually a constant, and pethidine I think, but mostly morphine. Diamorphine, benzodiazepams, those are going to vary. Then we're going to ask you the right way of giving a CDA or a DDA drug. And what are you going to tell us? You're going to tell us that you go for this drug, the two of you. You go with the doctor's prescription. You go get the drug from a locked, they have to be in a locked space because these are controlled drugs, remember, right? And where is that key kept? If you're using a key and lock, it is with the charge nurse in that department. So you go and get it, you're confirming the two of you, everything, the 5 hours of this drug have been confirmed. You take the drug again, you come the two of you, and then you give the patient this drug, okay? Of course, you're going to ask you about the inventory. Be keen about the inventory in your department. If you find that there are 5 or 6 fire extinguishers, know where they are, because we definitely going to ask you something about the inventory, okay? If we're asking you how many temperatures there are, how many thermometers are there, then you need to be able to tell us that information. So you need to start learning these things from the first day of your rotation or of the management assessment, so that by the time the assessment is coming, that information is all up there. Drug register. Most facilities have drug registers. Be keen to identify the kind of drug register that is there. If it is for the emergency drugs, be keen to see that it is up to date. Which drugs are there in the emergency drug tray? You cannot miss at least 3 of them. You're the manager, right? You already know those. And if it is not fully stocked, if you're having gaps in the emergency drugs, for example, calcium gluconate is reading 0, then what are you supposed to do? That is where acquisition of resources is coming in. We're going to get into that as the last part. As I said in the nursing care assessment, I'll say it here again. When you go that day of the assessment, you're making sure that the department is well okay before the day of before the assessors come in. The department is looking okay. You've done all the damp dusting. The patients are clean. Just a few things are left there. This is a secret. Just a few things are left there for you to oversee. Even that helps you to not have so many questions on that day. So you get into the morning, take the report of the ward, know how many patients are there, okay? You also need to know all the conditions of the department, okay? All of them. Every patient at least be aware of what they are being managed for. You're likely to just storm into one room and ask you, who is this patient and what are we managing this patient for, okay? We're not likely to go into the details, but we're likely to ask you that, and you need to know at least the most common drugs that are used in that department, the nursing care, those nitty-gritty things, because we are going to ask you, what have you done for this? What has this patient been done for since morning, or for the past 2 hours? What has this patient been done for? So you need to keep up every time. with everything. If there has been any incidences, please be very keen to know those, especially maybe a patient declined surgery or a patient declined treatment and they want to go home against medical advice. You need to be chop about that. Make sure that you are handing over after the assessment, or when you're told to hand over, at least you know how the department is, so you hand over accordingly. You hand over precisely. If the patient is going for an x-ray, a patient is going for a CT scan, hand over very eloquently and very confidently to another person. I'll say this again, please make sure that the staff are your friends. Do not go to do an assessment where you are not in good terms with the staff, and this rapport is created on the first day, so that you are able to guide them appropriately. You can tell them, this is what, please help me do this. Because if something is going on in the department and an assessment is going on, you need to be talking to the staff, and that is a part of assessment. If a relative or a patient comes in, say hi, be the person that goes there to say hi, get the information. Of course, this information, you're not going to hand over it to a student, you're going to do it with a staff. Delegation is going to be something that you're going to be assessing. Have a good attitude from the word go. The attitude matters a lot. Even how you're speaking to those relatives, or you're speaking to the patient. If a patient is calling you and you're assessing you, do not tell the patient that you have an exam. Just go and respond to the needs of that patient. Evaluate what the staff has done. After delegating, you want to evaluate, right? Or whoever you've handed over to. Do not forget that. Maybe you told the staff to go and dress someone, or you told the staff to go and take someone to an ultrasound, confirm that it was done, and then appreciate them. You did this, it is good. That is a form of motivation. So these are the nitty-gritty things that you need to have taken care of before the day of the assessment and on the day of the assessment. As I've already said, the number of patients is key. Just have that in mind. You need to know special procedures for special patients. For example, if a patient, we've gone to a room and that patient is diabetic, let us know how do we manage this. Before we give insulin, what do we usually do? We're going to ask you those kind of things. We need to ask you the most common conditions in that department. You never like those conditions, right? Depending on the department, just make sure at least you know 3 to 5. So we'll ask you about the critical patients in that department. For example, you have maybe 4 patients on oxygen. Rest assured, that is going to be a question. So know everything about them. The nursing care plans for those patients must be up to time, not even up to date, like up to time. So the patient is supposed to be feeding at 10 a.m. They need to have fed at 10 a.m. If they have not fed at 10 a.m., we find the tea or the milk there. We're going to ask why it is there. So you have to keep up with it. If you have juniors, keep them up. Keep them up to pace. And not only are we going to look at the care plans of these the most sick patients in the department, all the other care plans need to be up to date. Sawa. Acquisition of resources. For example, if we are going around and we find a tap is broken, we're going to ask you about the tap. It might not be broken, it could just be there. You need to know where things usually come from. Mostly they come from the procurement office, through the finance, or the finance office, just depending on the facility. So on the level of facility, you need to know that kind of information. Proper use of this equipment. How do we, maybe the inventory, the books, the stationery, just proper use of them. That can also come in waste distribution. That you know what I'm talking about, the yellow bin, black bin, and red bin. You need to have your environment looking okay. We cannot be walking into a room and then we are finding the room is not neat. For example, the procedure room. And if you're going to walk into a room, maybe it is the slowest room, it is a procedure room, just know definitely if there is anything there that is worth asking, we're going to ask you about it. Okay? For example, mostly the question that usually come from the procedure rooms, what I've seen, is usually the disinfection buckets, the jig water, soapy water, and clean water. Those are there. How do we dilute the jig? how did you get to, maybe 9 is to 1 or 6 is to 1. So you need to know that. Know the concentration of zinc in your facility. Those are the kind of questions you're going to be asked. And in that, they make sure that everything in that room is okay. You do not want to be getting there and the dates on those disinfection buckets are from 2 days ago or 1 day ago. The dates have to be current. That is why you have to go early in the morning and do these things way earlier. The couch is well made. These are top sheets. There we have maybe a sheet for covering the client when they come in. Let's just be nice. The sluice room, be alert on what happens in the sluice room, because if you go to the sluice room, you're going to ask what really happens here. Sometimes things happen, and you might find that something has not been done where you're going, maybe in the procedure room, or just in a room, or just in the pavement as you're walking by. You realize there is a mess. Do not assume that mess. Try to communicate to the staff or to the student, and communicate efficiently, delegate appropriately, and be kind while doing it. Okay, we've talked about the right attitude in all this, but it's just a 1 day thing. It's not a whole 24 hours thing. It's just a few, like 30-20 minutes, and you're done with the assessment. So be at your best behavior. I'm going to ask you about student and staff welfare. Tea comes in handy. Chai, you cannot miss a point in that. Breaks come in handy. You cannot have staff and the students working the whole day. You get exhausted. You get a burnout. You need to relax. You need to go for your tea break. You need to go for your lunch break. So that is a part of student and staff welfare. We can have tokens here and there, in forms of money or gifts. We can have birthday motivations, for example, coming through, cards, or again, token, money speaks a lot nowadays. So we can have that. Those are the kind of, that is the kind of welfare. If somebody is sick, they are supposed to go for sick offs. Admission procedures, being friendly to the staff working in that facility or the students working in that facility. Them being attended to promptly, without delay. In the outpatient before they come to inpatient, that is a staff welfare and student welfare. If something bad happens to a staff or a student, maybe an accident has happened, we need to have those. That is form of welfare. Already, those are so many points. Yeah, maybe visiting, getting permission to go and visit these people. Maybe they have lost their loved ones. That is still welfare. Cindy, we are definitely going to ask you about the patient care activities. And the most important tool here is to have the 24-hour activity up on the wall, on a chart or somewhere. Okay, we need to know what happens when are the visiting hours, so that we do not go disturbing relatives in the department. So these are the kind of information you need to know. Have it there. When are the M shift reporting to work? When are the A shift reporting to work? So we need to have that information. In a very fast manner, let's go through your checklist for the management assessment. Okay? The first one is your name tag. Very important. And you make sure that everybody is wearing a name tag and is in full uniform, whether it is a staff or it is a student. That is a checklist. Number 2 is a 24-hour daily activity schedule. This somewhere there, or you have it and we can see. Number 3 is the duties. Okay, we need to see that you're a manager, you know how to make duties. No, you cannot copy the ones that have already been made by the charge nurse in that department. You have to make your own duties. They have to balance at least. What do you think number 4 is? Number 4 is you need to have information of the ward that morning, the number of patients. Number 5, is it number 6 or number 5? I'm not sure. Information about inventory is supposed to be here. I remember when I was being assessed back in college, I was asked to go and show them where the generator of the hospital is. That was wild, because that was a level 5 facility, county facility. The other one of my other students was asked to go and take them to mortuary. The other one was asked to go and switch off the lights of all the facility or show them where it is all controlled, you know. So these are the nitty-gritty things that you're likely to even get asked. So you need to have that information. That is another checklist, at least know where buildings are. Another person was asked to take them to SSD, where drums are sterilized and gauzes. So I think those are the checklist. I don't know what else you need to know. Mostly those are the at least six most important things you need to do and have in your checklist before the big day. Otherwise, I want you to know that you got this, you're going to pass. Okay, and if you passed after watching this video, come and comment down here below.